Hey, I'm Dr. Elizabeth Bowes at Integrated Health Solutions, and today we're going to talk about pelvic tilt. So pelvic tilt is just a relationship of your pelvis in relation to your low back or your spine. So you can be tilted forward, which would look like this. Okay, so the back is higher than the front and the front is tipped lower. You can be neutral or you can be tipped all the way back. You should be able to control that, but mostly stay in the neutral range. So there's a normal group that has a lot of pelvic tilt, and that would be pregnant ladies. They get pulled forward just based on the weight distribution of the baby, and that is normal for when you're pregnant, but it's not really normal the rest of the time. So you really need to be able to maintain a neutral spine when you're standing, when you're sitting, when you're laying down. Another thing that causes it is basically tight muscles and or a weak core. So if you have really tight hip flexors, if you have disengaged abs, if you have really tight low back, these are things that can tip you forward. And then the opposite, having what they call a posterior pelvic tilt, if you have extremely tight hamstrings, that can pull you backwards. That is less common than being tipped forward. A lot of people who are tipped forward sit at a desk all day. If you sit for driving or at a desk all the time, that can cause a lot of the tensions that cause anterior pelvic tilt. So why is that important? Well, it affects how your core works, your ability to keep pressure, and it is also a good indicator of your ab strength and your core stability. Also, for any kind of athletic activity, even just playing golf, you need to be able to control the pressure and your relationship. So during your golf swing, you need to be able to make sure you have a neutral spine, not tipped too far forward or tipped too far back. So go ahead and try this at home. Look in the mirror sideways and line your fingers up with the bones on the front, the bony parts on the front of your hip, and wrap around and see, are your fingers level? Are they tipped forward or are they tipped back? And that'll give you a lot of information about yourself. This is one of the things that we work on at Integrated Health Solutions, and one of the things that we check to give a full picture on what we need to be working on. If you like this kind of content, like and follow our page.